Well, we have in the studio with us on this morning the Assistant Professor of Pharmacy Practice here at the College of Pharmacy and Health Sciences at Texas Southern University. Dr. Veronica Ajewole is the Assistant Professor of Pharmacy here at Texas Southern University. She has her postgraduate education in oncology pharmacy. She did her residency at Houston Methodist Hospital. She has her Doctor of Pharmacy degree from Texas Southern University. She also received her postgraduate 1 year in pharmacy residency.
Yes.
And so we'd like to welcome here on Impact Houston Live with us, Dr. Veronica Ajewole.
Good morning, everyone, and it's such a pleasure to be here this morning. Thank you for inviting me.
We are so glad to have you. But I just want to say this. A huge congratulations. I think that is so awesome, which is why she's here, but I just had to say that first. Okay, go ahead, Chris.
Thank you so much.
Thank you. Awesome. Go ahead.
I know. We're all excited about this.
I know. It's huge. Y'all, this is huge. Check this out.
Check this out. So Dr. Ajewole, introduce yourself to the community and audience. Tell us a little bit more about this program and yourself and what you all are doing here at the Texas Southern University's College of Pharmacy.
Absolutely. Thank you. Good morning again to everyone out there in the community this morning. My name is Veronica Ajewole. I am an Associate Professor of Pharmacy Practice here at Texas Southern University. I am a TSU alum, graduated in 2015. By training, I'm an oncology clinical pharmacist, and I have my practice site at Houston Methodist Hospital. Most recently, we had the opportunity to receive a $1 million grant through CPRIT, and I am the principal investigator and the director for the Texas Southern University Breast Cancer Screening and Prevention Center.
So, Dr. Ajewole, what is TSU Breast Cancer Screening and Prevention Center? Tell us a little bit more about that.
Thank you so much for that question. So TSU Breast Cancer Screening and Prevention Center is a grant-funded program that provides no-cost breast cancer screening, patient navigation, and education, among other services, to uninsured women, especially to African American women and other ethnic minority women within the community. This program was initially funded through Susan G. Komen in 2018 under the leadership of Dr. Rodney Hunter, myself, and Dr. Uche Ndefo. But of course, we all know 2020 pandemic came, so there was a little bit of twist in what we could do. But thankfully, in 2021, recently we received a $1 million funding through CPRIT, and CPRIT is the Cancer Prevention and Research Institute of Texas. So that grant came in under my leadership in collaboration with Dr. Paulie Niravat at Houston Methodist Hospital, as well as Dr. Uche Ndefo. The great thing now is the grant we had previously was only able to provide services to women in the Third Ward area. But now, with this $1 million grant from CPRIT, we are able to offer services to women in 5 counties. And these counties are Harris County, Grimes, Matagorda, Walker, and Wharton. So any woman living in these 5 counties, we're able to offer services to them.
So Dr. Veronica, so why, why this initiative? Why is this initiative important?
Absolutely. I mean, that's a great question. So we all know that the whole concept of health disparities, right? This is something that is very predominant among women of color, African American, and ethnic minority women. So this is really the why. This is really the driving force for myself and the entire team that, we came together to write this proposal. But essentially, when we look at the number, African American women have been shown to have worse breast cancer outcome than other women, within the community. And also, these worse outcomes are associated with advanced disease and diagnosis. So we are here, trying to proclaim and advocate that women should screen early. There is this verbiage, early detection saves lives. So we know nobody wants to hear the news of being diagnosed with cancer. However, if a patient is diagnosed with cancer at an early stage, it is potentially curable. So that's why we are out here providing education, advocating, and providing no-cost screening mammogram to women that are eligible for the services that we provide.
Now Dr. Ajewole, I want you to kind of talk about what are some of the stigmas that you come across when you're educating and bringing awareness to women, right? Because I've had the opportunity to work with some prostate screenings that we do at our church, and when we're talking with brothers about their PSA, there's a stigma around, you know, getting your prostate checked for brothers, right? Brothers ain't in no rush, right? if it's not the blood drawing, they don't
take my blood.
Yeah, talk about some of the stigmas or some of the misinformation that women may have in terms of their breast cancer screening that you come across.
Absolutely. And I mean, thank you so much for bringing up the prostate cancer situation, because I happen to also be the PI on a CMS funded grant on prostate cancer, where we are studying aggressive prostate cancer. But I know that's not the topic for today, so I will.
We'll have you back. Don't worry. You see how everybody said in unison?
You are on it. I love
Professor
it.
McFarland's like, come on back.
Come on back.
Devin.
I'll be glad to come back. So we're gonna talk about prostate cancer on another day.
Okay.
But shifting focus to the breast cancer program, you are very right. And that's why the education that we provide, we make sure that it is culturally sensitive, because everybody receives information in a different way.
And I'm glad you say that, because a lot of times, so some people will hear you say, well, you have this grant, you go over 5 counties, you can expand your research. And some of us may think in a silo and think that's just for African Americans, but we're diverse in Houston and across these counties.
Right.
So you're dealing with all nationalities, right? And all different walks of life, correct?
Absolutely. And that's why, all our staff members, our patient navigators, we are very conscious of that.
Right.
And when we go out there to offer information, we offer information in layman terms.
Right.
We don't know if the patient standing in front of us is a PhD holder or a third grade level of education. We make sure that we present the information to them in a manner that they can understand, in a manner that they can absorb, and in a manner that would stimulate their interest to take ownership for their own health. Because the best thing we can do are the things we are doing right now, right? We are providing education, providing resources, providing convenience of services as we go.
Convenience.
Exactly. And however, we need to ensure that whatever information we are providing to the patient population is something that is easy for them to understand. And you are very right. Houston is very diverse. Our team members are also able to interpret in Spanish.
Okay.
And even if we come across patient population that is non-Spanish speaking, we have, resources to interpret in other languages.
Right.
Even though our program is specific, towards African American population, we do not turn people from other ethnic identification away just because they speak other language or what have you. We are here to offer services to uninsured, underinsured population.
And so that's what I wanted to kind of touch on next. You may have already hit it, but who is eligible for the services and everything that you guys provide, and where would they be going for these services?
Absolutely. So our goal is essentially to offer services to uninsured or underinsured women. Some people ask me, what do you mean by underinsured? Some people have an insurance card, but that insurance does not cover the cost of the services at the 100%. So what our grant will do is, we look at the insurance. Even if you're going to have a copay, our grant is going to cover the cost of that services so that our patients will not receive any bills from the services that they are receiving through our program. So uninsured, underinsured, the general recommendation is for women after the age of 40 to receive annual screening mammogram. So once a woman is above the age of 40, please come see us, come to our site. But there are women that are under the age of 40 that have been identified to have high risk for breast cancer, primarily because of genetic risk, maybe because they have family history, things of that nature. Then they would also be eligible for our services. And of course, if these women are living in any of these 5 counties, so Harris County, Grimes, Matagorda, Walker, and Wharton.
Wow. So what are the next steps for women who come, let's say they get screened and unfortunately they get a positive? What are the next steps for them, for women who test positive in this program?
Absolutely. Thank you for that question. That's also another question that I get.
Pathway to treatment.
Exactly. Like how do we get them to treatment? Because, considering that the women that come to us, they are either mostly uninsured, a few of them underinsured. And unfortunately, the diagnosis of cancer does not translate to them receiving insurance right away.
Right.
And we know that with cancer diagnosis, the clock is ticking. We don't have 3 months to sit around. We don't have 4 months to sit around. So with that, we have patient navigation services that would assist these women to gain, access to a healthcare facility that would cover the cost of their services, Medicare, Medicaid services, charity insurance program. But one other one that I want to really acknowledge is the commitment of Houston Methodist Hospital. We are working in collaboration with Houston Methodist Hospital, and Houston Methodist Hospital Community Benefits has made a commitment to provide no-cost treatment.
Wow.
That is huge. If you all look at the cost of treatment for a patient with breast cancer, it runs in thousands, right? So Houston Methodist Hospital Community Benefits has made a commitment to treat at 100% cost for women that have diagnosis of breast cancer, especially those that have advanced diseases, those that have aggressive diseases. So women with triple negative breast cancer, women with stage 3, stage 4 aggressive disease, you are uninsured, underinsured, diagnosed through our program, you would have a full cost coverage of your treatment directly through Houston Methodist Hospital.
So let me just clarify. So a young lady or a woman comes to y'all's treatment, comes to this event, and they're screened, and it is found that they are negative, they have breast cancer. So they don't have to worry about now, how do I get treatment? They immediately are enrolled with you all to go ahead and start receiving treatment.
Exactly, yes. So the treatment path would have to be one or two ways. If they are advanced disease, triple negative breast cancer, stage 4, stage 3, aggressive type of diseases, our patient navigator would route them through such that Houston Methodist Hospital would absorb them into their charity care program. The alternate thing will be our patient navigators will walk them through the system, try to identify a location that will be able to assist them in their treatment coverage. Wow. So either way, no matter, the stage, the type of breast cancer that a woman is diagnosed with through our program, we make sure that we don't leave anybody hanging.
Yeah. But and I was just going to say, so how can members, I don't know if Chris was going to ask this, but how can members of the community find out more and register for this event?
Absolutely. That's a great question. So, and I did forget to mention that the screening services that we provide are offered through 2 major routes, right? So one of them is the mobile mammogram. I don't know if you all are familiar with the big van.
Yeah, absolutely.
So we are able to go out to community locations, community centers, churches, federally qualified health clinics to provide these services to the community. So we do that, and that offers us the gift of what? Convenience. The gift of access, because we are coming to you. You don't have to come to us. So we do that mobile screening services. We also offer these same services through in-clinic screening, meaning we can schedule women directly to go screen at any Houston Methodist Hospital location. And we know Houston Methodist Hospital has, 7 locations across the greater Houston area. So that is a benefit, again, addressing, the issue of access. Some people get off work late. Some people, weekends is the only time that is convenient for them. So we're able to do this. In addition to us providing, mammogram services, we also offer education. So we can come to you to offer education education at your church. We can come to you to offer education in your community location. We can do it hybrid. I mean, COVID has taught us to be very efficient virtually. So we're able to offer these services either in person or virtually. And of course, because of our patient navigation services, we also offer support for transportation.
Wow.
Believe me, Houston is, I mean, we know Houston and you know several of these counties, transportation can be a barrier. So part of the things we do, if a patient comes to us and say, oh, they don't have enough funds to cover transportation from their home to receive services, then we will cover the cost of that transportation. Metro, you know, whatever it is, we'll make sure that we're able to get them back and forth to where they need to be. We offer interpretation services. We offer, you know, assistance with scheduling for the services that we provide. So in between all of this, you know, we offer these great services to the community that is that really needs the services that we offer. And then, you know, cycling back around now to answer the question of how can people reach out to us. We try our best to be available social media. So on all social media platforms, you can find us at TSU BCSPC. So on Twitter and Instagram, our handle is TSU BCSPC, or you can give us a call 713-313-4424, or you can call 346-238-4636. If you want to reach us by email, we are also available. Go ahead and send an email, breastcancer@tsu.edu. I will repeat that again, breastcancer@tsu.edu. The other way to also reach us is by text, right? We try to make sure ourselves available and reachable. So simply text TSU Breast Center. TSU Breast Center, all the same word, to 855-264-9031. I will say that again. TSU Breast Center to 855-264-9031.
Do you know, I have to say, your passion about this subject is unbelievable. You love what you're doing. You're very passionate about what you're doing. And it's just, I'm just looking at you just smiling. I was like, oh my God, look at her. I wish you all could see her. She is just, I love that.
Thank you, Ms. Donna.
And we're going to have you back to talk about prostate for black men. Because did you see how she lit up about that?
Yeah.
Man. And then she's working on something there too?
Yeah.
That's why I love working at Texas Southern University, period. Because it's some heavyweights over here. And we don't even know, but we about to know. Okay?
All right.
We about to know.
Thank you so
Dr.
much, Ms.
Veronica,
Donna.
wow. I'm in total awe. Congratulations.
Thank you. I'm very grateful. You know, I'm very grateful for the opportunity. All of this that is happening would not have been possible without, you know, God. First.
Amen.
And to him alone be all the glory.
Yes.
And then the support of, you know, TSU leadership.
Right.
You know, the Madam President,
Yes.
VP Penn Marshall,
Yes.
Dr. Lale, my Dean Musavin, you know, the staff and, you know, all my collaborators. I don't do this alone. It takes all of us.
And we've had Dean Musavi on before, I think.
Yeah.
Yes, we have.
Yes, we have.
Yeah.
But she's coming back. We're coming back. I think that's going to be I think it's in September, October.
No, October is.
I think it's October.
Is Breast Cancer Awareness Month.
Yeah.
correct?
No, that's breast cancer. We're talking about prostate.
Well, prostate is September.
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 So
Okay.
we're going to have you back in
Oh
September.
man, so we may have her two months in a row.
Okay, that's true. September
man.
and October.
I'm here. TSU is home. Okay.
Okay.
So
Yeah,
I'm here.
Okay.
With Dr. Ajewole, we get here early, so we'll fix you a pallet. Professor found out the hard way, right?
Had to stay the night.
right.
Thank you so much.
Thank you. And thank you so much. We'll be right back on